Following your manufacturer's instructions for use. Objectives. Throughout this presentation, we'll define what an IFU is and why they are important. This will include FDA requirements for IFUs, as well as examples of medical devices and products that have IFUs. Then, we will help you identify what risk factors are associated with not following IFUs. And finally, we'll describe where to find IFUs, how to interpret packaging symbols, examples of what IFUs may look like, and provide you with information about electronic and manual IFUs to help you decide which type will benefit your facility most. Throughout this presentation, we'll refer to the instructions for use as IFU. IFUs are required instructions which provide detailed, action-oriented, step-by-step written and visual instructions for healthcare professionals on the intended use of medical devices and products. IFUs can include instructions for appropriate cleaning, disinfection, and sterilization of surgical tools and instruments, as well as the products that need to be used for these processes. These instructions will also provide important measures to include how to use the product or medical device, preparation, for example, how to set up a device, administration, which can include medications or vaccines, as well as handling, storage, and disposal of these different items. IFUs can include information on whether testing is to be performed for the various devices or equipment, and how and when to do so, maintenance instructions and schedules, and how to troubleshoot if one is having issues with devices not working as they should. Something else that you may hear IFUs being called are manufacturer's instructions for use. The main goal in the perspective of following IFUs within a healthcare setting is to provide understanding of how products and equipment are to be properly used and maintained to be most beneficial to that setting. Next, let's discuss FDA requirements. FDA requirements and processes. The U.S. Food and Drug Administration, or FDA, plays a crucial role in advancing medical innovations and regulating products that consumers use daily. The FDA is a federal agency under the Department of Health and Human Services that is tasked with protecting public health by ensuring the safety, effectiveness, and security of human and animal foods, drugs, vaccines, medical devices, and more. This also includes that accurate health information is provided to the public. As you can imagine, IFUs are a big part of this. These next points are key in ensuring that all requirements and processes are met when creating IFUs. 1. IFUs are a type of FDA-approved labeling that, as mentioned before, includes detailed instructions for proper use. 2. The FDA specifically mandates that medical device manufacturers provide IFUs to consumers. IFUs are controlled by the FDA and must include detailed instructions on how to use, maintain, and dispose of a medical device. 3. Manufacturers are required to complete a multi-process approval before the device can be sold or used. 4. Facilities are required to follow IFUs to ensure safe use. Healthcare facilities are legally required to follow the IFUs provided by manufacturers for medical devices and equipment. It is considered a critical component of patient safety and is enforced by regulatory bodies like the Joint Commission and health facilities. Always know that FDA processes are required by manufacturers to ensure IFUs are validated and approved. With the importance of manufacturers having to go through the FDA process requirements, we'll next cover more reasons why IFUs are important. Why are IFUs important? IFUs help reduce the risk of errors and accidents by ensuring that healthcare professionals can use equipment and products accurately. They also make sure that products and equipment are being used for their intended purpose. For example, if a glucometer is being used on multiple patients or residents, but the IFUs state that it is to be used as a single-use device for individuals. The IFUs then inform us of the intended purpose. With this example, you can see how it also helps remind healthcare professionals to use these items safely and effectively. In many healthcare settings, the most commonly violated manufacturer's instructions for use are those related to cleaning, disinfection, and sterilization of reusable medical equipment. IFUs break down how products should be set up, proper maintenance, as well as how to store them properly when they are not in use. To go along with maintenance, especially for medical equipment, IFUs will include directions on how to clean, disinfect, and sterilize items effectively to prevent infection control gaps. Failure to follow such instructions or misuse creates significant risk to safety, quality care, and can lead to risks of infection and/or complications for patients. It's also important to understand that risk of infection associated with failure to follow IFUs may lead to patient notification events that may be costly and have consequences for a facility, including reputational harm. Risk factors to not following IFUs. We'll now go more in depth with what some of the risk factors are of not following IFUs. You will find that IFUs often come with warnings that if diverting from their specific instructions, it can lead to issues in safety. One of the biggest safety concerns when not cleaning or disinfecting items like shared medical equipment properly is putting your patient or resident at risk for infection. For example, a staff member uses an approved surface disinfectant wipe to clean a shared medical device, such as a blood pressure cuff or a glucometer, between patient or resident. The disinfectant IFU states that the surface needs to remain visibly wet with the disinfectant for 4 minutes, which is the specified contact time to effectively kill common pathogens like C. difficile or MRSA. The problem is that the staff member, due to time constraints or a lack of training, quickly wipes the device and immediately puts it away, or uses it on the next patient or resident without allowing that surface to stay wet for the required 4 minutes. The surface has now dried in seconds. The end result is that the pathogens are not killed and the device remains contaminated, creating a significant risk of transmitting infections to other vulnerable patients or residents. Next, equipment breaking down or malfunctioning is another problem that can occur when not maintaining it per instructions. Some cleaning products may not be the right one to clean a specific medical device or equipment, as it can be too abrasive, which can wear materials down more quickly and render them unusable and needing replacement. Or maybe a metal or wired brush was used to clean a surgical instrument that has now scratched that tool, making it more susceptible to catching bioburden and not being able to clean it properly anymore. Or it may start to rust, which would have not happened had the proper cleaning tools been used, which were noted in the IFU of the surgical instrument. This again would now be something that would need to be replaced, which can come with a cost and delay in procedures. Finally, it can also mean that items not being handled according to instructions for use are no longer under the manufacturer's warranty, as it was voided the moment it was decided to deviate from the IFUs. Which medical devices and products have IFUs? There are many instances during on-site visits where we are asked what medical device or product has an IFU. To identify which items have IFUs, you'll find them marked either by a symbol on a box, package, a package insert, or order form for the products and medical devices that you are using. It's crucial to recognize that each product and patient care item has its own IFU for things such as cleaning, disinfection, maintenance, and more. If the item does not have an IFU, it is possible that it is not FDA approved, which would be a reason why you are unable to find the IFU. It is a requirement and expectation for healthcare organizations to follow the included instructions. Where to find IFUs. Now that you know what IFUs are and what items have them, Let's talk about where to find these IFUs the next time you look at a product or equipment. Depending on the product, device, or equipment, and how it is packaged, it can be found in many different places. You may find it directly on packaging, packaging inserts, boxes, labels on bottles or containers, or directly on certain devices and equipment. If you are unable to find the IFU, it's important to contact the manufacturer as soon as possible to get the specific IFU for the item before putting it into use. Also, if you know that you had IFUs for an item, but they are no longer in a place that you can remember, be sure to replace it as quickly as possible. This could be the one time where the IFU was updated, and if you do not have it, you could be using it incorrectly, making it ineffective or posing infection risks. In addition to knowing where to find IFUs, in the following slides we'll share examples of labels and what is important to look for when looking at the various IFUs and symbols that can be found on products and medical devices and equipment. Manufacturer's packaging symbols. Here are examples of different symbols that you may find on the manufacturer's packaging. These symbols are generally associated with many of the products in use and are intended to ensure that the manufacturer's IFUs and storage are followed. Ensure that staff are properly trained and understand these symbols in order to maximize the product and to protect all individuals that these are being used on. A few examples to point out on this slide are the first being in the top row, third symbol from the left. You'll see the number 2 with a line through it, which indicates a single-use or do not reuse device. This is important because many times during assessments, we find items that should be single-use items, but instead are being utilized as a multi-use item. For example, PPE such as single-use or disposable gowns that should be changed between care activities. Other symbols worth mentioning includes the symbol in the bottom row, first box from the left, that reads "Keep away from sunlight." Also in the bottom row, the fifth box from the left. Notice the symbol representing the presence of natural rubber latex. Remember, always check your gloves because it is important that they stay out of the sun as it can make them break down more quickly and can cause germs to penetrate through them. In addition to keeping them out of the sun, make sure that you are aware if the gloves are latex or not only for the safety of the individuals that you are using them on, but also staff who may be allergic to latex. Let's move on to more examples. Let's now look at the top row, upper left-hand corner, where you will see an hourglass. This represents the expiration date or the use-by date. Now let's look at the bottom row, third symbol from the left. If you see this, it means that the instrument must be autoclaved. We point this out because there are individuals that may carry their surgical scissors around for various tasks, but if you look closely at them, they may have on the scissors themselves where it shows a temperature and that it needs to be autoclaved between uses. For similar items, be sure that they are being consistently used per the instructions for use. Next, we'll take a look at the disinfectant label. Reading disinfectant labels. If we take a closer look at this specific disinfectant label, it breaks down different control measures to make sure that you are following all directions for use. This one specifically makes sure that you know where this product may be used, what pathogens it's effective against, surfaces it can be used on, and generally how to use the disinfectant appropriately. It provides contact times, meaning how long a surface needs to stay wet and saturated with the disinfectant in order to kill the germs, as well as storage and disposal guidance to ensure that it can be safely disposed of if expired. Next time you get a chance, go to your supplies closet and look at your bottles and take a closer look at the different labels. Maybe even take it a step further and challenge some of your staff to see if they know where IFUs are and if they can answer questions about the product according to their IFUs. It's important to note that any staff or contracted staff responsible for using any of these products or devices should always be trained on how to follow IFUs and have documented competencies showing that training, and that correct use of these products has been performed prior to them using them. Example of a packaging insert. Here's the last example of what packaging inserts can look like. These you will normally find within a package or box, and have fine print that are oftentimes difficult to read. Even so, be sure to keep this or get a version from the manufacturer that is legible to add to your library of IFUs. Electronic and manual IFUs. We want to make you aware that there are options for how your IFUs can be stored. First, there are various electronic IFU systems that are like digital libraries. They are used to keep the IFUs together easily and systematically. They are routinely updated, and staff are usually able to access them from anywhere in the facility, which is a benefit to help reduce the risk of infection with quicker accessibility. Next, using a manual form such as a binder of IFUs is another option available to health facilities, as long as everyone knows where the binder is kept, as they are normally located in one centralized area of the facility. It's important that they are always kept together and that they are routinely updated with the most current instructions. This will mean that someone will need to be held accountable for manually printing them off or take them from whatever device or product packaging to ensure it is the most up-to-date version. The manual process of creating binders can become time-consuming and may increase the risk of infection. This is because, as we all know, time is something that healthcare professionals do not have much of, and that means one can forget to update the binders as planned, and eventually let it go altogether, which is a common gap that we find with this route of maintaining IFUs. It's important to note, hospital settings with a sterile processing department should have these instructions for use posted directly at the site where equipment reprocessing is performed. The final thought is that you want to be sure that you have one or the other, not only to stay consistent in following IFUs, but to always provide the best infection control possible. Something to also keep in mind about IFUs is that regulatory partners that come in to conduct surveys do like to ask about IFUs and if you know where they are located within your facility. Again, if they are manual binders, you want to be able to know that all staff are able to show them exactly where they are and that they are being kept up to date. This is also the case with electronic systems, but it is normally much easier to provide them with that information. The hard part is deciding if the manual or electronic style works best for your facility, what is most cost effective, and which will help reduce risks. As a reminder, following IFUs are another way to help ensure that patients, residents, visitors, and staff are kept safe, and that these resources are preserved as much as possible. Thank you.